Hi everybody and welcome to my channel Hubit Bibi. This video of mine is about a very common illness, that is pelvic inflammatory disease, also known as PID in short form. This is an infection of the female reproductive organs. It most often occurs when sexually transmitted bacteria spread from your vagina to your uterus, fallopian tubes or ovaries. The signs and symptoms of pelvic inflammatory disease can be subtle or mild. Some women do not experience any signs or symptoms. As a result, you might not realize you have it until you have trouble getting pregnant or you develop chronic pelvic pain. Now, let me tell you the symptoms. The signs and symptoms of pelvic inflammatory disease might be mild and difficult to recognize. Some women do not have any signs or symptoms. When signs and symptoms of PID are present, they most often include pain, ranging from mild to severe in your lower abdomen and pelvis. Abnormal or heavy vaginal discharge that may have an unpleasant odor. Abnormal uterine bleeding, especially during or after intercourse or between menstrual cycles. Pain during intercourse. Fever, sometimes with chills. Painful, frequent or difficult urination. You should see your doctor or seek urgent medical care if you experience severe pain low in your abdomen, nausea and vomiting with an inability to keep anything down, fever with a temperature higher than 101 Fahrenheit or 38.3 degrees centigrade, or you experience foul vaginal discharge. If you have signs and symptoms of PID that are not severe, still see your doctor as soon as possible. Vaginal discharge with an odor, painful urination or bleeding between menstrual cycles can also be a symptom of a sexually transmitted infection. If these signs and symptoms occur, stop having sex and see your doctor soon. Prompt treatment of an STI can help prevent PID. Causes. Many types of bacteria can cause PID, but gonorrhea or chlamydia infections are the most common. These bacteria are usually acquired during unprotected sex. Less commonly, bacteria can enter your reproductive tract anytime the normal barrier created by the cervix is disturbed. This can happen during menstruation and after childbirth, miscarriage or abortion. Rarely, bacteria can also enter the reproductive tract during the insertion of an intrauterine device, which is a form of long-term birth control, or any medical procedure that involves inserting instruments into the uterus. Now let me tell you the risk factors. A number of factors might increase your risk of pelvic inflammatory disease, which include being a sexually active woman younger than 25 years old, having multiple sexual partners, being in a sexual relationship with a person who has more than one sex partner, having sex without a condom, douching regularly, which upsets the balance of good versus harmful bacteria in the vagina and might mask symptoms. Having a history of pelvic inflammatory disease or sexually transmitted infection. There is a small increased risk of PID after the insertion of an intrauterine device. The risk is generally confined to the first 3 weeks after insertion. Now let me tell you the complications. Untreated pelvic inflammatory disease might cause scar tissue and pockets of infected fluid, which are known as abscesses, to develop in the reproductive tract. These can cause permanent damage to the reproductive organs. Complications from this damage might include ectopic pregnancy. PID is a major cause of tubal or ectopic pregnancy. An ectopic pregnancy can occur when untreated PID has caused scar tissue to develop in the fallopian tubes. The scar tissue prevents the fertilized egg from making its way through the fallopian tube to implant in the uterus. Instead, the egg implants in the fallopian tube. Ectopic pregnancy can cause massive, life-threatening bleeding and require emergency medical attention. Infertility is another complication. Damage to your reproductive organs may cause infertility, which is the inability to become pregnant. The more times you have had PID, the greater your risk of infertility. Delaying treatment for PID also dramatically increases your risk of infertility. Chronic pelvic pain. Pelvic inflammatory disease can cause pelvic pain that might last for months or years. Scarring in your fallopian tubes and other pelvic organs can cause pain during intercourse and ovulation. Tubo-ovarian abscess. PID might cause an abscess which is a collection of pus to form in your reproductive tract. Most commonly, abscesses affect the fallopian tubes and ovaries, but they can also develop in the uterus or in other pelvic organs. If an abscess is left untreated, you could develop a life-threatening infection. Now let me tell you the preventive measures. To reduce your risk of pelvic inflammatory disease, practice safe sex. Use condoms every time you have sex, limit your number of partners, and ask about a potential partner's sexual history. You should talk to your doctor about contraception. Many forms of contraception do not protect against the development of PID. Using barrier methods such as a condom helps to reduce your risk. Even if you take birth control pills, use a condom every time you have sex with a new partner to protect against STIs, sexually transmitted infections. You should get tested. If you are at risk of an STI, make an appointment with your doctor for testing. Set up a regular screening schedule with your doctor if needed. Early treatment of STI gives you the best chance of avoiding PID. Request that your partner be tested. If you have pelvic inflammatory disease or an STI, advise your partner to be tested and treated. This can prevent the spread of STIs and possible recurrence of PID. Do not douche. Douching upsets the balance of bacteria in your vagina, so it should be avoided. Now let me tell you the diagnosis. There is no one test that can accurately diagnose pelvic inflammatory disease. Instead, your doctor will rely on a combination of findings from your medical history. Your doctor will likely ask about your sexual habits, history of sexually transmitted infection, and methods of birth control. Signs and symptoms. Tell your doctor about any signs you are experiencing, even if they are mild. A pelvic exam. During the exam, your doctor will check your pelvic regions for tenderness and swelling. Your doctor may also use cotton swabs to take fluid samples from your vagina and cervix. The sample will be tested at a lab for signs of infection and organisms such as gonorrhoea and chlamydia. Blood and urine test. These tests may be used to test for pregnancy, HIV, or other sexually transmitted infections, or to measure white blood cell count or other markers of infection or inflammation. Ultrasound. This test uses sound waves to create images of your reproductive organs. If the diagnosis is still unclear, your doctor may recommend additional tests such as laparoscopy. During this procedure, your doctor inserts a thin lighted instrument through a small incision in your abdomen to view your pelvic organs. Endometrial biopsy. During this procedure, your doctor inserts a thin tube into the uterus to remove a small sample of endometrial tissue. The tissue is tested for signs of infection and inflammation. Now, let me tell you the treatment. Prompt treatment with medicine can get rid of infection that causes pelvic inflammatory disease, but there is no way to reverse any scarring or damage to the reproductive tract that PID might have caused. Treatments for PID most often include antibiotics. Your doctor will prescribe a combination of antibiotics to start immediately. After receiving your lab test results, your doctor might adjust your prescription to better match that is causing the infection. You will likely follow up with your doctor after 3 days to make sure the treatment is working. Be sure to take all of your medication even if you start to feel better after a few days. Treatment for your partner. To prevent reinfection with an STI, your sexual partner or partners should be examined and treated. Infected partners might not have any noticeable symptoms. Temporary abstinence. Avoid sexual intercourse until treatment is completed and symptoms have resolved. If you are pregnant, seriously ill, or you have a suspected abscess or have not responded to oral medications, you might need hospitalization. You might receive intravenous antibiotics, followed by antibiotics you take by mouth. Surgery is rarely needed. However, if an abscess ruptures or threatens to rupture, your doctor might drain it. You might also need surgery if you do not respond to antibiotic treatment or have a questionable diagnosis such as when one or more of the signs or symptoms of PID are absent. So this was an important video about pelvic inflammatory disease, and I hope you have liked this video. And if you have any other illness or if you are suffering from PID, you can write your comments in the comment section, and I will try to make a video about your illness as soon as possible. And if it is not possible, if I don't find a time to make a video, then I'll try to reply to your comment as soon as possible, because I reply to almost every comments. Okay, and Till now, if you haven't subscribed my channel, please do it now and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit, then please give a thumbs up. Give a thumbs up to this video, because this will give me encouragement to make more useful videos such as this. Okay. And also do not forget to share my videos to others through social media such as Facebook and Twitter, because this channel of mine, Hobet BP, is basically created for helping humanity across the world. Thank you so much for watching this video. See you in next video. Bye for now.